Good evening, everyone. It is such an important day for all of us. Amidst the wonderful experience all of us are having under lockdown, at the same time, physically, though we are under lockdown and maintaining a social distancing, it has given us a lot of opportunity to explore inwards. For today, we have a very special activity which has been undertaken to reach people across the world a wonderful message by none other than the chairman of India Expo Mart, Rakesh Kumarji. I welcome Rakesh Kumarji. You have
Namaskar.
taken a wonderful initiative because of which I am sure this message is going to reach the whole world. Along with this, we have great personalities who are going to share their knowledge on this concept of integrative medicine and particularly the role of integration in a situation like COVID-19, which makes it more so important. So, as our panelists, we have Dr. B.N. Gangadhar, the director of National Institute of Mental Health and Neurosciences from Bengaluru. We have Dr. Raghavendra Rao, the director of Central Council for Research in Yoga and Naturopathy. And we have Dr. Akshay Anand, who is the renowned integrative medicine practitioner as well as a neuroscientist from PGI Chandigarh to share their knowledge. Before we move on with today's webinar, I request our team to start this whole webinar with a wonderful message through this video.
शुभं कुरुत्वं कल्याणं आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणं आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपनमोऽस्तुते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश मतिं स्वच्छामि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठेत् गृहे दीपः तस्य नास्ति दरिद्रता शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः
Wonderful. The message given to all of us is dispelling the darkness through light. And our Honorable Prime Minister has displayed this wonderful gesture a few days back when the whole country participated in lighting Diya, whereby we thoroughly enjoyed entering into darkness by switching off the lights and then lighting a lamp gave us that thrill which we had forgotten. And this is what this message gave us. Let me start today's webinar by introducing the host first. Okay, so we have Rakesh Kumarji, who is the chairman of India Exposition Mart Limited at Greater Noida. He has conceived this idea of establishing the biggest ever expo mart in India. I know Rakesh Kumarji very personally. In a meeting, he mentioned that when he visited China, he visited many other countries. That really troubled him. That what's wrong with us? That we can't have such huge infrastructure for actually presenting our wonderful things what we have in India. That has brought him this idea that we should do it, and he has done it. And it is not just creating an infrastructure, he has also brought in such a great expos which goes on across the world, such something like an auto expo and a print pack, ADB, the bank related, are very few to mention. And he has created a world of reference for handicrafts of India through a very special expo which he has created. Expo on one side, and of course, he has created a place for all artisans of handicraft to actually present their articles as well as do the export of them through this infrastructure. And he has played a very important role in the establishment of the National Center for Design and product development. And he has received several awards. Actually, the most important, the Safari India South Asia Travel Award for IEML establishment, Super Achiever Award, and so on. And his hunger for innovation and promotion of Indian tradition and culture hasn't stopped. It has brought him to the promotion of Ayush in India. So hence he has conceived yet another amazing idea of promoting Ayush through World Assembly of Ayurveda, Yoga and Naturopathy, which was initiated last year. And this webinar series is an extended activity of World Assembly of Ayurveda, Yoga and Naturopathy, also termed as Ayuryoga. And more than anything, he is highly spiritually rooted person, highly qualified, and more than all this, a humble individual. Request Rakesh ji to make your introductory comments, and then we will go for the actual webinar.
Namaskar. Thank you very much, Dr. Manjunath ji, for very kind words. In fact, I don't deserve so long introduction. Anyway, namaskar to all dignitaries and participants. It is a pleasure to have such eminent members on our panel for the third webinar of Ayuryog Expo, World Assembly on Ayurveda, Yoga and Naturopathy. Today we have with us Padam Shri, Dr. B.N. Gangadharji, Director of National Institute of Mental Health and Neuroscience, Bengaluru, Dr. Raghvendra Rao ji, Director, Central Council for Research in Yoga and Naturopathy, Dr. Akshay Anandji, Professor Neuroscience, Research Lab, PGI, Chandigarh, and one of the important personality today has accepted our request to moderate this session is Dr. N.K. Manjunath ji, Head, Anveshna Research Laboratories of S. Vyasa. Today we can see that many eminent personalities from modern medicines and traditional medicines are here. Founder, CEO, CMO, research scholars, and doctors of various national and international hospitals, institutions, healing centers, and resorts are in the audience. The idea of Ayuryog Expo, a world assembly on Ayurveda, Yoga, and Naturopathy, was conceived by Padam Shri Guruji, Dr. H.R. Nagendra ji, and executed at IML at the international level to benefit the mankind under his blessing and guidance. He traveled from a great scientific journey to meditational journey from NASA to Vyasa, from west to east. Guruji applied this concept of integration in the medical system where Ayush and modern treatment system works together. In 2019, the first edition of Ayuryog Expo received humongous participation from Ayush industry. In fact, the international footfall was in thousands, which is a huge number for the Ayush exhibition sector. This time in 2020, Ayuryog Expo World Assembly is going to again take place in the month of October. Friends, the clutches of COVID-19 are getting stronger every day. We must fight together with the integrative approach. The government of India has been very bravely fighting against it. More than 650 persons have registered for this webinar, so we can understand that interest people have gathered in this particular program today. And also we have many senior faculty and senior people who have joined here in this particular program. We have with us Shri Shant Manuji, a senior IAS officer who is also practicing yoga himself and also the Ayurveda and other medicines he is practicing. He is also with us in the audience today. And there are other people I would like to just name those personalities. Mr. Brent Boyer, MD Mayor Clinic, USA. I welcome you, Mr. Brent, and I welcome all other also senior person joining this program. Mr. Pradeep Jyoti, MD Vasudeva Vilasam Group. Adriana from Madrid. Shekhar Chaturvedi ji, MD Natural Biotechnology Private Limited. Swami Chidanand's Institute Director, Divine Yoga. Miss Deepa Shri from WHO. Rakesh Ahuja, owner Vedic Oils. Rebecca Priyadarshini from Nature and Healthcare Center. Pharma Covigilance Program Officer, Dr. Vimal. Manoj Padmanabhan from Qatar. Shri Santosh Joshi ji from Hamdard Laboratories. Rajesh Adhikari ji from Talk Pharma. R.K. Verma from EPCH. Selvin from Almighty Wellness Private Limited. Dr. Archana from Alvas Group. And Gaurav from Kerala and many other stalwart people. They are today with us. I'm sure that panelists are going to contribute in a great way. And looking forward, Dr. Manjunath ji, please take the webinar forward for the deliberations. Thank you very much.
Thank you very much, Rakesh ji. You have given a platform and an opportunity for actually reaching those questions which bothers most of the practitioners who would like to bring the best of various systems together. So the topic for today is barriers in integrative medicine. As I said, it's more so important because we are all seeing how the whole prevention and treatment approach, which is being followed in the management of COVID-19. We have many open-ended questions, though we are so grateful to our healthcare delivery individuals who have made it happen that the experience has been so far really under control in a country like India. So what we have planned for today is first we are going to have a sort of an opinion on this topic from our experts, mainly the three panelists who are present. So first I introduce Dr. B.N. Gangadhar, who is going to give his opinion on this topic of barriers in integrative medicine. Just once again, in brief to mention about Dr. Gangadhar, as mentioned earlier, he is the director of the most prestigious National Institute of Mental Health and Neurosciences. He is the senior most personality and an authority in yoga and mental health. He, with MBBS MD in psychiatry from NIMHANS, he also has the highest award for yoga in the form of a DSE from S. Vyasa University, recipient of Sir C.V. Raman Award, Padma Shri, one of the highest civilian awards of Government of India, published more than 400 research papers in indexed international journals with an H index of 42. And his areas of interest include yoga, schizophrenia, public health, and electroconvulsive therapy. Request Dr. B.N. Gangadhar sir, as one of the senior most legendary figures in the field, to share your
Well, many thanks for inviting me to this webinar. I made some notes on my cell phone in the last 48 hours to be able to do justice to what the topic today is. What are the barriers in in application of integrative medicine, and particularly so in the light of COVID, which we are seeing. Firstly, barriers have existed, whether COVID or no COVID, in the last several decades for application of integrative medicine. Let's admit that. There are several reasons. I may not want to go into the reasons. That is not the objective of today's discussion. But suffice to say that each branch grew on its own. And like one of our senior colleagues puts it, each of us have been working in silos without looking at each other, looking away from each other, and for some reason or other, there is some exclusivity, and we need to bring back the inclusivity, not just for the current purpose of COVID, but in general for a healthier medical service, which is an integrative medicine. This is number one. Number two, COVID is, as we know, COVID-19 is a viral disease, a new virus, a novel virus, and we do not have a definitive medicine in, at least as far as I know, in the allopathy to combat this viral disease. However, there are many interventions that are possible both from the modern medicine and from other conditions, other medicinal approaches to fight this disease. At the public health level, we have all been told distancing, hygiene, avoiding overcrowding, avoiding travel. Some of these general principles will reduce the transmission of the disease. But what is important is when a disease strikes me or any one of us, what do we do? How do we combat that? And how do we come out of it safely? In this context, several research questions have come up in many groups. But the catch here is majority of the people who are struck with COVID actually get well spontaneously. In fact, that should be a reassuring view which we need to communicate in this webinar. A large majority of them get away without any complications. In fact, a good number of them, almost half of them, would well be asymptomatic without any illness at all. And among those who become ill, a very, very small proportion would actually have a fatal outcome. In fact, even amongst those symptomatic, those needing actually hospitalization will be a smaller proportion. So together, the outlook for this disease is not so horrifying as somehow it has been brought forward to, and most of us have become panicky. It's true that we have to be worried about this disease, but not necessarily become panicky. Now, for this condition, there are many interventions that I believe are available. As far as I know, yoga is one condition. Yoga is one intervention which can potentially improve the immunity and probably be able to endogenously or autogenously fight the disease, which is something that I'm sure yoga people sitting in this meeting are already talking about, are going to talk about. Then in Ayurveda, yesterday morning, I heard there is a preparation which is conventionally given whenever there is a viral infection of the upper respiratory tract, which gives a lot of potential to combat this disease. Whether these two interventions are automatically recommended for integrative treatment of this viral condition is something that we need to pressurize. I think it should happen. Hopefully, with a collective pressure, we should be able to give the best from all branches of medicine so that the patient's outcome is going to be the best rather than what we are now saying. Back to Dr. Manjunath.
Wonderful, sir. Because when we talk about panic, you are the authority, and you said it. If not bringing yogic intervention, there are certain issues which make you feel panic. And you have addressed all of them to give a clarity to people that we don't need to panic, because very small a proportion of people are going to have either fatal results, complications, even very small are going to become even symptomatic. That is a very good understanding what all of us need to have. I'm going to take a few questions immediately after the two other panelists talk, because there are lots of questions coming based on your opinion and inputs what you have given. So with this, I move to our second panelist to give his opinion. Dr. Raghavendra Rao, he is the Director of Central Council for Research in Yoga and Naturopathy, Ministry of Ayush, Government of India. Dr. Raghavendra has a Bachelor in Naturopathy and Yogic Sciences and a PhD in Yoga and Integrative Oncology. He has served as an Associate Professor at S. Vyasa University in the beginning, and later moved to head the CAMP programs at Healthcare Global in Bengaluru. And he has specialized in yoga and molecular biosciences, conducted several clinical trials in using yoga as an adjunct or an adjuvant therapy in the management of cancer-related issues. And he has also been part of a clinical trial conducted on yoga on breast cancer patients with MD Anderson Cancer Center in Houston, USA. He has published several papers in various areas related to yoga and cancer, guided many masters and doctoral students, and presently heading one of the bodies which govern yoga and naturopathy in the country, Central Council. Dr. Raghavendra, for your opinion, please.
Thank you, Dr. Manjunath, and good evening, friends. Happy to be amidst all of you this evening session. Before we talk about what integrative medicine is, we need to understand that we have come a very long way. 1992, the Ayush systems of medicine, or the other system of medicine apart from allopathy, were called as alternative medicines in 1992. NIH had set up a National Center for Complementary and Alternative Medicine in the year 1992. And this branch of medicine, which did not have any sort of proof or any sort of evidence, was known as the other system of medicine or the alternative medicine. Later on, a lot of research happened. And when they started integrating this medicine along with the conventional care, it was called as the complementary medicine. But today, in 2014, we now have a new branch of medicine called integrative medicine. NIH NCCAM is now being rechristened as National Center for Integrative Health in 2014. And this is where is the beginning of the birth of integrative medicine, where they are trying to integrate all the other approaches as much as possible to take care of most of the non-communicable diseases today. Now, this being the case in Western scenario, they have gone way ahead of Indian scenario, where you can see integrative medicine centers in almost all the university medical teaching hospitals in the Western countries, especially in US. When we come to India, there's a tough war. You have Ayush on one side, and you have the allopathy and the conventional medicine on the other side, which go like two different tracks on the railway, and they seldom meet or seldom talk to each other. The moment we try to talk about integration, you do have a lot of barriers. And the first barrier is when you talk about an infectious disease, Ayush is a no-no for most of the allopathy practitioners. Why I say this is very simple, because in the last 1 week, I've been talking to various allopathy doctors, various heads of the various reputed institutes in the country, trying to convince them on how we can integrate yoga into the aspects of COVID-19 positive patients. And I get very, very lame excuses. I get some small excuses saying that patient may be lying on the bed, you are teaching them yoga relaxation technique, what if he collapses? Okay? And they may say it is because of your yoga which you have done. I don't see that as a possibility at all, because they say they attribute that to the cytokine storm which can come, and we have not seen any case of cytokine storm, a sudden collapse happening in India as compared to a lot of the Western country even today. But to say that these are a lot of barriers, because each one wants to safeguard their own turf, It's important that we become very open. We know there's no solution for COVID-19 right now. The only way is to supportive care. And we also know that this is a viral disease. It's a self-limiting disease. In many patients, it's become asymptomatic. And those who have good immunity are able to come out of it unscathed. What is it that we can do as Ayush system? How do we try to integrate our efforts to the benefit of the community here? It's very, very important. There's some areas which I want to pick up here. Most of this, I went to some of the COVID-19 case centers, and I was shocked to see these patients. I believe these patients are in the room alone throughout the day, no contact with nurses or anybody whatsoever. It's only on emergency do they have or do they come in contact with any nurses. They are left to fend for themselves. Sometimes they're not even having a mobile out and for entertainment. There's no TV, there's no mobile. Imagine a person in a ward with infection and nobody to take care of him. Okay, even the food is given on the table, the person has to come to the door and take his food from the tray. Okay, nobody goes even near to the patient at all. This is the kind of scenario it is. There's a lot of fear which is there among the healthcare people as well. There's only in the ICU where you have patients closely monitored by the healthcare team. Okay, with a lot of precautions. That being the case, I think it makes very, very important sense to have a yoga intervention. So why don't we use a mobile yoga app? Why can't they just put some earphones on their ears and do some relaxation? Why can't they do shavasana? Why can't they do some real simple breathing exercise, some pranayama? Okay, it helps in killing their anxiety. It helps in taking care of their anxiety. It helps in reducing their fear. It helps them to cope with that particular situation. Okay. So I was fortunate yesterday to talk to two patients in the COVID-19 ward. I won't name the hospital because I had gone just see the tour of the COVID-19 wards. And I just talked on phone to two patients and I said, how do they feel about it? They are waiting to get out of the place as early as possible. Okay? They are saying, I don't know when I want to get out, when I'll get out of this place. Okay? It's very torturous for them because there's no caregiver allowed next to them. There's nobody whom they can talk to. So what I advise the healthcare people is, at least if you're not going into the ward, at least make it a habit, at least in an hour, talk to them on phone, have a WhatsApp video call, or something you start doing there so that you engage these patients in some activity or other, some conversation or other. Otherwise, it is just boredom inside. The temperature is running high. Some people are most asymptomatic. Most of them are also asymptomatic. And when they're asymptomatic, nothing is there for them to do. They're COVID-19 positive, and they're just locked up in a room. Okay, it's just like being in a jail. That's what they said to me. It's like being in a jail, and this is the worst thing which can happen to anybody. Okay, one of the patients said, I have never experienced this kind of this thing. More than the disease, it is the treatment which we are getting is more pathetic for us because we can't be isolated like this. So what is important here is the healthcare people have to be sensitized to their needs as well. We need to see how we can take care of their isolation anxiety. Very, very important. And can we use yoga approaches? Okay, can we do something to the immunity? So the simple things like they have dry cough. Something can be done to help in taking care of the dry cough. Symptom management. If you don't have an allopathy, why don't you try something with Ayurveda? Have that openness in mind to see that something can happen. And unfortunately, I hope I'm not supposed to speak because I also belong to the government. But I hope there is a lot of openness among the community, medical community soon, that they would encourage other Ayush modalities to also integrate their efforts to the betterment of these patients. Thank you.
Yeah, that's right, Dr. Raghavendra. You also gave a perspective of what exactly is happening at present with an probable exposure of the need for other alternative methods as complementary methods rather to support what the existing kind of line of treatment which is going on in most of the hospitals. And also the basic definition of integrative medicine as defined by National Health is more of a kind of a suggestive that probably there is a need for complementing and integrating, and we are not talking about any alternatives. So this is the clear message what we would like to give. Integrate and complement. Probably these are the two better words which can make everyone feel comfortable in bringing these systems together. So having heard from two authorities as well as administrators of two wonderful institutions, NIMHANS and CCRYN. We have with us Dr. Akshay Anand, who is the professor at the Department of Neurology and specialized in neurosciences at the PGI Chandigarh. He has completed his master's in biotechnology and a PhD in neurogenetics. He is the editor-in-chief of Annals of Neurosciences as well as Integrative Medicine International. So along with this, he is part of the editorial board of more than 30 international journals. He has received several awards for his contributions in the field of neuroscience as well as integrative medicine. Very few to mention are the award from American Academy of Neurology, Retina Research Foundation of USA, as he was also been the nominee for Padma Award from the UT government for this year. Dr. Akshay Anand has several fellowships, published more than 140 research papers. His areas of special interest include cell survival mechanisms, but over 2 decades, he has been working in the field of integrative medicine. So you come with such a rich experience of integrative medicine on one side, and you have experienced probably the probable barriers in the application of integrative medicine, as Dr. Gangadharji mentioned. So please give your opinion, Dr. Akshay Anand, about application of barriers in integrative medicine.
Dr. Manjunath, thank you, Rakeshji. Thank you, Dr. Gangadhar, for a nice introduction to the topic and identifying the key profile of the disease and the roadblocks also, and the good things also. Some hope that most of the people are asymptomatic and a lot are recovering back. And thank you, Dr. Raghavendra Rao, telling us why we need integration. Because you see patients who are trying to walk out of the ward, they are anxious, they have a lot of uncertainty. So can I define your why or expand or explain your why we need integrative medicine by saying that we have an untreatable disorder here. We are now in uncertain times, and there is no cure. There is symptomatic management. Our doctors, teams, our healthcare workers are all in the forefront. Don't we suddenly all agree we have a need? We feel there is a need why we need integration, because we need to combine, as Dr. Gangadhar said, the preventive approaches or the public health approaches with the anxiety lowering approaches such as yoga, pranayam, with the other approaches where we can maintain our immunity, good food, maybe some herbal food, and can we maintain our balance in some way. So there is a reason now that we have an untreatable disease and there is a need for integration. Now, what do we need to integrate is what I thought I will talk a little bit about. Do we need to integrate modern medicine with Ayurveda? Do we need to integrate this with yoga? Do we need to integrate this with Chinese medicine? Or should we integrate this with something else? Who will answer this question? So I keep asking myself, Dr. Manjunath, what to integrate and who will answer? Where is the evidence? Where is the evidence that we should integrate Ayurveda with modern medicine? So I speak from the scientific perspective. I'm a scientist. I work in a research lab, and I am exposed to clinical situations my colleagues see in the OPDs of neurology, in the OPDs of nephrology, in dermatology, in medicine. They come up with their own clinical criteria, and we collaborate with them on their defined criteria. We either take the blood or their CSF and then examine the new markers, which will prognosticate the disease or diagnose the disease. But we are mainly driven by the clinical definitions our clinical colleagues provide us. So we are not as lucky as Dr. Gangadhar is, where he has a singular model of integration, where he has a kind of an Ayush or an integration of yoga happening in his own institute, where unlike me, he can also get clinically defined cases from the Ayurvedic angle. So, for example, his colleagues who are Ayurveda acharyas or yoga acharyas will come up and tell him, Dr. Gangadhar, here is a patient of asymptomatic patient, COVID positive, but asymptomatic. But he and a group of another 9 or 10 patients are having tridosha, one of the Ayurvedic principles of classification, that he is of Kapha Prakriti. All of them are of Kapha Prakriti. In PGI, where I work, or in All India Institute, I do not know for my international viewers. Maybe some of the international viewers have their institutes where they have this kind of an integration that Dr. Gangadhar heads. Do they have access to this information of the kind of clinical prescription or the clinical definition of the patient that they see? Probably not. So as a scientist, how do I answer this question, what to integrate? Unless I have an institute, a college, or a university where a lot of patients come, and particularly patients of untreatable disorders come, whether they are non-communicable disorders such as Alzheimer or diabetes, and now more importantly, COVID, do I get this information of Ayurvedic principles, Ayurvedic classifications, and then I take their blood, and then I look at the Ayurvedic drug being administered, and here is my result of the better counts in the blood, representative of disease recovery, versus those who got just hydrochloroquine, for example. So I can only come to what to integrate by research only if I have in my system people from Ayurveda, people from Unani, people from maybe Chinese medicine, all the systems of medicine within the same institutes, under the same umbrella, so that I can answer this question, what to integrate, when to integrate, and how much to integrate. So Dr. Manjunath, what you challenged me and all of us was, what are the barriers of integrative medicine? And Rakeshji, this is really the reason. This is really the barrier. And the barrier can be easily put or categorized into administrative barrier. How many of our institutes being run by governing bodies have a person from yoga, Ayurveda? How many of our institute ethical committees have people from, now institute ethical committees, for the information of the international viewers here, some of them may not be researchers. Anything we want to do to answer the question, what to integrate, will have to be done in a research methodology, and which will need to be cleared by an ethical committee. Now, if the ethical committee does not have a person from the Ayurveda background or a yoga background, they will not understand the study design, and therefore we will never be able to answer a question, what to integrate in managing COVID. We will not be able to answer this. So we need, that is another barrier at the integrative medicine, at the ethical committees level. At the level of governing bodies of these institutes and medical colleges, do we have a person from the alternative therapies? In our ministry, do we have IAS officers who are from the medical MD background, from the allopathy, as well as people from the Ayurveda, and as well as from those with a PhD in yoga, to be able to administer and roll out an integrative medicine program? Do we have MD, PhD programs where the MD Ayurveda can do a PhD and a PhD can do an MD in Ayurveda or MD in even allopathy, even if not for practice, just for research? Unless we have an integration at the level of education, at the level of administration, at the level of the ethical committees, at the level of the governing bodies, at the level of the ministries which manage this show of rolling out strategies for containing COVID, I think we will not be able to, essentially roll out a very nice integrative medicine program. So these are my few thoughts that jumped in my head, and be happy to take more questions as we talk along. Thank you once again, Dr. Manjunath.
Dr. Akshay, I asked you less number of questions, and rather you have asked me more number of questions now. So that's wonderful. The whole debate should go in a way whereby we answer questions. Unless we ask the questions, there is no chance for answering them. So totally agree with you in a way that the barriers for integration are at various levels. It is not just creating a common protocol Okay, so it is at various level, including administrative, academic, also at education, and more so for doing research. The bottleneck is ethical committees, as you rightly said. And I'm sure Dr. Gangadharji has gone through all of them for years. So he has been the most experienced person in seeing the issues related to integration, because he has brought in a reproducible, successful model of integration at National Institute of Mental Health and Neurosciences. We all need to congratulate him for doing that, because it's a work of years. It's not just few days. So, sir, there are many questions coming up. So the first thing comes is, uh, how did you actually put it together to create it as a model at NIMHANS? So I know that we have a similar model at AIMS Delhi now. Similarly, attempts are being made at establishing a Center for Integrative Medicine at PGI, AIMS Rishikesh, and many other places. We are actually grateful to the Ministry of Health and Family Welfare and Ayush, because they have initiated bringing a unit of Ayush in all upcoming All India institutes. So there are at different levels, few things are happening. But we would like to hear from you, sir, that what was that magic you have done to create this integration at NIMHANS?
Thanks, Manjunath. There are two issues here. One is, how did we make this possible, and how have we made it sustainable? Now, how did we make it possible? The important issue is the allopaths who are practicing in all the modern hospitals. It is important that we develop a culture of being open. And this is precisely what was possible because of my contact with people who have been preaching yoga, whether it is Guruji, Dr. Nagendra ji, or Shri Ravi Shankar ji. At both places, I saw a need to look at it firstly objectively and look at it without any biases. So that was possible. I was willing to be open. Started applying those in psychiatric practice that I was doing. Thanks to many yoga experts who helped me in giving the yoga through various modes. And thanks to the Morarji Desai National Institute of Yoga, and also now the CCRY also, where they thought it's good to invest on yoga research and yoga services. At NIMHANS, they gave some seed money to begin with. So we made yoga to be available as an additional service to all our patients. Whether psychiatry, neurology, or neurosurgery patients, we opened an opportunity to all our colleagues to avail yoga services for their patients. It is up to them to make a referral. To facilitate this awareness, we did a series of small academic meetings and also a yoga appreciation course and so on and so forth. So in the institute, between the time we started and now, the awareness or the spontaneity with which they would refer people to yoga got better. And what was just about 2 or 3 cases in a week now is almost about 70 to 80 patients being referred every week. So this is one change that happened over course of time, thanks to a lot of people who participated, a lot of people who expressed their cooperation, and thanks to a team of allopathic doctors who worked with me, were open to the applications of yoga. This is number one. Secondly, thanks to the Ministry of Health, at the time, Naddaji was the health minister. When the issue was brought up, he was very spontaneous and he said, you need to convert what you are running as just a yoga center, advanced yoga center funded by Morarji Desai National Institute of Yoga. You think about it and convert this into a more vibrant academic department. This was the time we chose to develop a department. Initially, we called it as a center for yoga, wherein we sought faculty positions at the level of yoga, Ayurveda, and mental health, psychiatry. All three levels of doctors were sought after, and we asked for these positions. The positions of assistant professors were given. But most importantly, the conversion to department happened thanks to Dr. Kotecha. Akshay, you made a mention that are there any Ayush people in the governing bodies and institute bodies? NIMHANS institute body is represented, one of the members who represents the institute body is the Secretary of Ayush, an Ayurveda expert, none other than Professor Rajesh Katocha. So since he is there, I think that clinched the last point. Why just a center? Why not does it become an integrated center for integrative medicine? And so I think you said it very rightly, being open, having people who matter, who create opinion in at different governing body levels, made it a fact that it is not another Ayush group sitting here, but it is an integrative medicine group sitting here. So as long as we see the entire application as an Ayush and a modern medicine, two different things, we simply keep going parallelly without getting integrated. And I think this is the example that NIMHANS has set, losing the difference between Ayush and non-Ayush or a modern medicine thing. So we have now become a sustainable model of integrative medicine in mental health, and I am sure this will go on to extend itself to neurosciences as well, as we have at least 4 different neuroscience projects in neurologically ill and neurologically ill people funded by the ministry to conduct research here.
So just in additional question along with whatever you have said, at NIMHANS is the introduction of yoga more of a patient-driven or based on patient demand, or is it a medical practitioner prescribed intervention?
Both happen. To begin with, so look, this is a modern medicine hospital. Nobody in the world would know that we also give yoga as a form of treatment. So to begin with, we had to do various awareness activities amongst our colleagues, and they began to realize, both from way of our publications and by way of whatever that was available in the literature, a realization came that yoga can be an additional treatment that can be given to these people, either as an addition to what they were giving or independently or standalone. So initially referrals started slowly getting added. Over time, when these patients who were in the wards saw that there was also a yoga services available here, the website also carried a yoga website in the NIMHANS main website center. Yoga link was there. So put together, people are now getting more and more aware. There are a lot of people may volunteer, providing they know that it is happening. And at least some of the clinicians are started saying that the yoga services is available, they can opt. And we started the yoga outpatients as well, yoga and Ayurveda outpatients. And I think more and more people now will start asking that we want this as the treatment. So it's two ways, Dr. Manjunath, both doctors driven and patients driven. The second part is coming in only more recently.
Sir, I have at least around 6 or 7 questions which are all addressing a same issue. They are telling that, for example, in the case of COVID, we don't have a proven medical treatment. So there is a possibility of trying whichever the practitioners or others feel that it probably can work in a condition like this based on their previous experience and evidence. So those are being tried. And WHO has started a global clinical trial now, studying 4 different treatment methodologies to understand which one will be more efficacious. So when we have one kind of norm for allopathic system, why is that such a resistance for bringing either Ayurvedic or any other, like homeopathy is another very well being spoken system of medicine. Naturopathy and yoga are the other systems which are being spoken. But why is this? I mean, I don't want to call it as a double standard, but why is that we don't have same approach for various systems of medicine?
Let me see if others contribute to this. I've been speaking for long. Dr. Raghavendra is there, Akshay, Dr. Rakesh. Let's see if there are other viewpoints before I combine.
Yeah, Raghavendra, I mean, if you honestly, this question is being asked to each one of you very frequently. Okay, that why is that you go to an conventional medical hospital and you know the line of treatment, but when you talk about Ayush systems, there is a reservation. The main question being asked is there is no evidence. In the case of COVID, in spite of having no evidence, the conventional medical treatment is being introduced at the level of World Health Organization, and World Health Organization has approved a clinical trial involving 4 different lines of treatment. So are we on right track, or what's your views on that?
Dr. Manjunath, just to put forth your views, as even Dr. Akshay was studying earlier, it is about openness of the medical community. Let me give you an example. I went to one very top hospital, which is the leading hospital for COVID-19 care in Delhi. And I met the pulmonologist. So even before meeting, they asked me to send a proposal. So I had sent a very well drafted proposal, research proposal, all the evidence based on using yoga for COVID, for viral infections, pandemic. There's another study which was published in 2018 by Wisconsin University, where they showed very clearly that adding on yoga to the population helped in reducing the incidence of acute respiratory illness in this population during a flu epidemic. So similar kind of logic we used to see whether it could be also used in a setting of COVID-19 positive disease. So we also want to we also had some concerns that people should not go to the ward and teach yoga to them because you have a chance of exposure. So we also made a mobile app-based program. Okay, and how do you want to measure the effects of yoga? How do you know the person is practicing yoga? We also developed a sensor technology used by IIT Mumbai. It's called DOSI, which can be placed under the mattress, and we can measure the stress of the patients. We can also measure the relaxation response after each yoga practice. So that being the case, we can remotely monitor the patients in the ward whether they're doing yoga or not. So the doctors were very much convinced with this, and they said, yeah, it's very good technology and a very good sound proposal. Let us go ahead. And next came the hurdle. They said, next you have to take the approval from the medical superintendent of the hospital. Then you need to take the approval of the IEC. So the medical superintendent of the hospital, and talked to them, and she said, no, you need to take the approval from the ministry. And I talked to people in the ministry. Then it took me about 2 days to figure out who in the ministry is going to approve the proposal in the hospital. And they said to me that the medical superintendent is supposed to send the proposal, which I gave to her, to the joint secretary in that particular department, and they have to approve it. So I had to go again to my joint secretary, see that he talks to them and sees that that proposal is forwarded. So imagine the kind of bureaucracy going on. If they were open to this particular idea, I don't think they would have made us to go to the bats. I don't think they would have made us to go roundabout and go in circles and do this and get this approval, get that approval. Because this completely intervention, they have no medicine interactions are not there. Using a mobile app, no side effects, nothing, because just a relaxation given to the patient. That kind of scenario, when the patient could have been made better with this kind of intervention, I don't see all these hurdles. It's like a hurdle race for all of us. Okay, so whereas you can see the Delhi government, I found the Delhi government to be very, very proactive in this compared to the central government. Okay, and they are in fact taking it up in a very big setting, and they want to integrate yoga and Ayush into all other modalities as well in most of the quarantine centers. Okay, that openness is very, very important. Unless that openness comes about, and they'll see I also agree. There's one more reason for this. One more reason is they don't have trust in the Ayush system of medicine. They don't know what is the Ayush system of medicine. Okay? They think we just make claims, we just make our own cases for putting our intervention forward without much evidence. I also agree most of them is also true, because a lot of people who also make a lot of claims saying that if this Kada is going to cure the disease, you're going to cure COVID-19 in this particular Kada. That is, Gomutra is used for this. Without even making any evidence, without really harms the reputation of the Ayush sector. Okay? And that is what, when that comes in a media, it comes out in public, it comes out in the public domain. So they try to step off. They don't want to have any controversies, and that's why they don't want to go meet and shake hands with the Ayush and say, yes, I'm open to this idea, let us do this. So we need to also try to educate them in a proper way. We should not jump the gun. We have to see how we can bring evidence in our own system of medicine, and just little bit of evidence is also enough. Okay? And to show that this can be tried, this can be possible in this particular kind of setting. You can use it as a quarantine setting, you can use it, probably you can use it in the convalescent setting, or any other setting which cannot interfere with their problems. So we can do something of that sort, find the middle path and go ahead. I think that will be the solution for us.
Certainly, what also attracts our attention is the research methodology used in Ayush studies, particularly yoga research. Dr. Akshay has been involved with several such studies. So, what exactly your opinion on either following a standardized randomized control trial for yoga research, or is there a scope for actually thinking out of the box to create a new research methodology for Ayush research? Dr. Akshay.
I can answer. I'm tempted to answer the first question that you raised, and then link it with the answer to the new question, which is also related. I think, in my personal opinion, we should slightly graduate from scientists proposing a research design to address a certain disease, from that to using the COVID epidemic. And I welcome critical comments of Dr. Gangadhar on this. So from graduating from a scientist to propose a research project to commissioning a project from the government for either vaccine development or Ayush medicine ABC efficacy testing, safety testing. And I think partly Dr. Raghvendra Rao's department is already entering MOUs with different institutes. It's a part of that process. So once you commission the projects, then you order it. There is no IEC. It will be taken at the time of commissioning. There are no administrative hurdles. Whether there is a dean of Ayush in these institutes or not, it doesn't matter. It is a commissioned project. It has to be done. These are the timelines, and this is what you will achieve in 6 months, and this is what you will achieve in a year from now. So it is like commissioning in times of war, you commission forces to the border. So this is a time, I feel, this is one formula that one can do. As for the deciding between the standardized yoga protocol versus customized yoga protocols, I understand the limitation of many individual yoga practitioners, individual Ayush practitioners who are working in small clinics, or even having their own one-man clinics, who are not able to publish their generated evidence, whatever that they are publishing. So in that case, they may be changing or customizing the yoga protocol or their medicine, mixing and matching, and claim to have cured cancer, and they claim to have reduced the burden of diabetes. They may even say that, okay, my COVID patient also got cured, but there is no evidence. We are not able to publish it. So again, I come back to that barrier of publishing, a barrier of not able to publish because you do not have an ethical committee in your singular clinic. So you cannot publish 100 population-centric intervention study of an Ayush system or a yoga protocol intervention outcome because you are in a clinic, or you are working in a group of 3 or 4 polyclinic. So we need journals which can provide a venue for their publications, for this evidence which is generated, even though it is not standardized yoga protocol or standardized drug, but whatever they have tested in a certain individual can become what is called as the N-on-1 trial. and it can be published by journals. So journal editors have to become more accommodative in publishing single case reports. So we launched what is called the Integrative Medicine Internet that you just mentioned. We entertain single case reports or 3-case series, and that doesn't even require an ethical approval because all it requires is an informed consent of the patient. We can publish it. So we can easily address Dr. Raghavendra's concern about a lack of evidence. So these single case reports or case series can constitute important evidence, which is a part of a big clinical trial which the institutions can take up. And combining this kind of an approach where you have a venue for publishing, so the evidence is generated and published and disseminated, combining that with the commissioning of projects, I think this is the way forward that I think as a researcher, we can move very fast and provide solutions to the society.
Yeah, certainly agree with you that it cannot be one solution. So we need to have a multi-pronged approach to really create a kind of an environment where it is just agreeing with each other rather than agree to disagree kind of a principle. So there are lots of questions which are being posed over here. I have a little more than 45 questions. And in the chat box, I have a little more than 65 messages thanking and really congratulating the panelists. So one major question which is being asked is, there are lots of questions related to Ayurveda, which I have not addressed over here. I have not taken them because unfortunately, in the today's webinar, we don't have an Ayurveda panelist. But the organizers have given me the information that each and every question will be circulated to the experts which are part of the panel, which will come as a series of webinars. And your questions will be answered by the experts in next another 3 days. So this is just for the information, those who have asked questions. And second thing, there are lots of questions, once again, on policy matters. Okay, like why are we hesitating so much to introduce yoga? Okay, for example, keeping all other systems where you have hesitation because you give an internal medication, but what stops you to use the simplest yoga practices? So very quickly, any of you can answer.
I totally endorse yoga. I think picked up as an integrative intervention in NIMHANS. I think largely because there is no, in quotes, invasive approach, which means I'm going to give one other medicine or one other thing. It is something that the person has to do on its own, and it's up to him to do or not to do. So I think this makes yoga a little more secular in terms of addable or givable in allopathic systems. I don't know, my experience with Ayurveda or other forms of Ayush interventions is very, very limited. Maybe now that we have opened the integrative medicine services with Ayurveda and yoga, both with allopathy, hopefully in the coming years, my successors will collect more experience and idea as to what to do. But I think it's a great day. It's a great opportunity to integrate. And integration is possible only if all forms of professionals, somebody said policy matters, if all forms of professionals can be seen on the same platform, the same level, with same dignity, a lot of intervention is possible and we can come together without any difficulty. So Dr. Manjunath, I have another VC at 6 o'clock. I request all the panelists to permit me to leave and a meeting so that I can log on to the next VCs at 6 o'clock. Thank you so much for calling me here. I know I'm going to miss some important discussions. Feel free to send any of those questions. If I think I can answer them, I'll be happy to answer those questions.
Thank you.
Thank you, sir.
It was an amazing contribution, which will actually open up many of those questions and thoughts which was bothering many people. So Dr. Gangadhar has actually answered many of the issues what we otherwise bother about. So thank you very much, sir. And you can please carry on. And we look forward to seeing you again in this platform. So we have another 10 minutes time to conclude our webinar for today. Dr. Raghavendra, there are many questions coming, particularly asking you to talk about the new directive which has been given from Ayush Ministry about the use of various methods used in Ayush systems for the management or probably the prevention and management of COVID patients. So there is Ayush system which gives a directive, and we have Ministry of Health which gives an overall directive. Okay, so there are few questions which are all quite similar to me, saying that is there a talk between Ayush and Health Ministry happening, or is there a gap between these two ministries? So if you have any information, I don't compel you to answer this because you are one of the authorities. So, but you are free to answer.
Yeah, I'll take this question. There is a guidelines which have been floated by Ministry of Ayush, and if you see, there's been a change in the guidelines over the last 1 month. Initially, when the guidelines were floated, it was said for management of COVID-19. So now they have removed that phrase to say the curative guideline or whatever it is, and they have just made it as to improve immunity. Very important. Okay, because we don't have evidence base for that. So they say that we're going to use a guideline only for improving one's immunity. Similarly, all the councils, the Ayurveda Council, by a task force, and followed by this has been already sent to the Cabinet Secretary for approval. Right now, the Ayurveda guideline and homeopathy guideline has come because they sent it much earlier, and we all asked to send the guideline about 2 weeks back, and it is going to be approved shortly. And the similar guideline which is there for yoga and naturopathy, I think many of them were asking this question. I just saw them on the Q&As. The yoga and naturopathy guideline is also there for both 2 ways. One is for preventive and prophylaxis. So all the guidelines have been divided into two slots. One is as preventive and prophylactic guideline. Other one is the symptom management guideline. Okay. So what can be done? Very simple practices. What can be done at home by the patients to prevent themselves from getting a COVID. So now we don't know whether immunity improvement is going to prevent somebody from getting a COVID. Why? Because why I'm saying you this one is because there have been a lot of instances even in Europe. There have been, you know, that Olympics was supposed to be held in the month of August, July, August, and it was postponed next year. And many of them were all training. You know, most of the athletes and swimmers in Europe were all Olympians, were all training for Olympics, and many of them fell sick with COVID. Imagine people with high endurance, high amount of fitness and training for Olympics getting affected with COVID, and they all came out unscathed out of it. They came out with less mild symptoms. So it shows that having a very good amount of immunity and fitness also doesn't prevent from getting this infection. It can just come to anybody. Okay, it will make it more asymptomatic, or it will help you to come out of it with mild symptoms. Okay, it won't make it such a severe kind of a disease. So this may also be just a claim. It is still has to be proved by science because COVID-19 is a very, very new disease, just a 3-month-old disease for us. Okay.
So you mean to say, Dr. Raghavendra, you mean to say that the two ministries are talking to each other?
Yes, there is a lot of talk going on between them. So even whatever guidelines we have been sent from Ministry of Ayush, it's been vetted by Ministry of Health as well.
And we have to congratulate both Ministry of Ayush as well as in particular CCRYN for actually working so rigorously in developing these guidelines. The ministry has been really working very hard. We have to place on record for the kind of paperwork what is going on, and we are sure that all that will be utilized appropriately when the opportunity is given. So I think we are coming to the end of this first webinar on Ayush. Just a message to our organizers, Rakesh ji in particular, you are here, and Praveen ji who are here, that there are questions being asked that we are not seeing any other experts from other systems of medicine, particularly Ayurveda, Unani, homeopathy, Siddha, and Sauringpa kind of it. So my answer on behalf of the organizers is that this will be a series of webinars. This is not going to end with this webinar. So one of the purpose was most of the people who were on board today were somewhere had an exposure and experience in yoga and yoga research. So we wanted to bring in the kind of similarities which people can merge their thoughts, whereby we can come out of a useful outcome for this webinar. Similarly, subsequent webinars are based and focused on involving all other experts from different systems of medicine. So I take this opportunity to thank all of you who have pulled your time out. Though we believe that lockdown period, all are at home or wherever you are, but my experience has been we are more busier than during normal working hours. So taking 1 hour is definitely something very important. And thanks for your participation. Thanks for your wonderful suggestions. Thanks for the questions what you have asked. And most of the questions will be answered. And I have to make a special mention about a few people, particularly Praveen Prabhakar, who is not appearing in front, but he is behind the screen in coordinating this whole activity. Okay. And of course, Tushar and many other people involved in making this webinar a successful one. And primarily thank Rakesh ji. This whole webinar is his brainchild. So you have created a platform and we feel proud to contribute. And thanks for inviting all of us. Thanks, Dr. Akshay. Thanks, Dr. Raghavendra. Thanks, Dr. Gangadhar. We also missed Dr. Indranil Basure, renowned cardiologist who was supposed to join today's webinar, who will be joining in the next upcoming webinars. Thanks once again, everyone, and I hand over the session to Rakesh ji.
So thank you very much, Dr. Manjunath. Thank you very much, all the panelists, Dr. Rao, Akshay, Dr. Akshay, Dr. Gangadhar ji, and thanks to Mr. Praveen Prabhakar ji team, Tushar ji, Niranjan ji. I would request Praveen ji to please inform about the next webinar. That is tomorrow's webinar, the subject and the details, please. Just for a minute. Praveen ji, please.
Sir, we are planning. We will share all the details very soon. Okay. Hello.
I think with this input, the details will come to you soon. We close today's session. I started with lighting the lamp, and I think we can close with a universal peace chant. Sarve bhavantu sukhinaha. Sarve bhavantu sukhinaha. Sarve santu niramayam. Sarve bhadrani pashyantu. Ma kaschid dukhabhat bhave. Om Shanti Shanti Shanti. Thank you one and all. Thank you.
Namaskar.